Hello, this is Virginia Dives, co-director of the National Aging and Disability Transportation Center. I'm happy to introduce our speaker on caregiver support, and this is Grace Whiting, actually C. Grace Whiting, and she is the interim CEO and Chief Operating Officer at the National Alliance for Caregiving. She leads the organization's business development, supports strategic planning, and develops relationships with key stakeholders in the family caregiving community, which is a huge and growing national group. In her work with the Alliance, she managed the launch of the Caregiving in the U.S. 2015 report with AARP and has contributed to several national reports on caregiving. And I want to include mention of those, including Caregiving in the U.S. in 2015, Cancer Caregiving in the U.S., which was done with the National Cancer Institute and Cancer Support Community, and Dementia Caregiving in the U.S. with the Alzheimer's Association. Grace has spoken on coalition building at national and international conferences and also did the keynote address at the National Institutes of Health workshop on the spectrum of caregiving and palliative care in rare diseases in June of 2015. Previously, she did advocacy and communications work at leaders engaged on Alzheimer's disease and has been the special assistant to the executive director at the Alliance for Home Health Quality as well, Quality and Innovation in Washington. She's a licensed attorney with the District of Columbia Bar. And with that, I want to welcome Grace Whiting.
Thank you so much, and I'm so excited today to talk a little bit about family caregiving and some of the work we're doing, as well as the relationship between caregiving and transportation. Now, if you're not familiar with us, the National Alliance for Caregiving is a coalition, a nonprofit coalition of over 50 national organizations that care about family caregiving. And when I say family caregiving, I mean both people who may be family either through marriage or blood, and also people who are families of choice, so friends, neighbors, others who you may have identified as being someone who can help take care of you if you have a disability or a health care need or an ongoing issue, just doing the activities of daily living. Now, we've been working on these issues for almost 22 years as part of our mission to advance family caregiving through research, innovation, and advocacy. And that includes essentially three types of work. We do public policy research on family caregiving. We do advocacy work in the United States, both at the state and local level and nationally. And we're the Secretariat for the International Alliance of Carer Organizations, which is a 15-country coalition of groups that care about caregiving and want to do something about it. And you can see here on this slide, if you'd like to learn more, you can actually visit our website at caregiving.org. Now, I'm going to be talking today a little bit about some of the research that we did with AARP, most recently in 2015. Now, this is a national research study on America's caregivers, and we estimate that there's about 44 million people across the country who are caring for adults or children due to a long-term or short-term health care need or disability. And in that report, we also were able to pull statistically significant and representative data, meaning that we sampled a group that looks like the United States, including oversamples for multicultural populations such as African Americans, Asian Americans, and Latino Americans. This research has been used widely by national media, such as the Wall Street Journal and the New York Times. And then we use the research with people on Capitol Hill, as well as other policymakers and thought leaders, to identify solutions for family caregivers. So let's start at the beginning. What is caregiving? And if you're in a caregiving role, if you are supporting maybe an older relative or a child with disabilities, you know that caregiving can be everything. And so you see on this diagram, many caregivers, they're shopping, they're running errands. Maybe they're providing financial support. Maybe they're helping to manage with healthcare conditions such as medications or taking people to appointments. Often caregivers are doing activities that require, keeping track of or coordinating care between several different kinds of service providers. And they may be communicating not only with those service providers, but also with other people who may be helping out, other relatives, friends, churches, or communities of faith. And in some cases, caregivers are also raising their own children while caring. And, last but not least, they have their own care needs, such as sleeping, eating, the career, and so forth. We can dig in a little bit here on the data and look specifically at what type of task caregiving includes. So this is one of the questions from that Caregiving in the U.S. report, and these are what we call activities of daily living. And you'll see here on this list, most caregivers are helping with these high-touch activities, things like getting in and out of the bed, getting dressed, toileting, eating, bathing, and showering. And on the right-hand side, you'll see two columns, and that blue column that says 21 plus means this is what it looks like for caregivers who are giving at least 21 hours of care a week. And on average, those caregivers are giving 60 hours of care a week. This is where I think transportation really comes into play, instrumental activities of daily living. So we know that nearly 8 out of 10 caregivers are helping with transportation. And in addition to that, they're helping with a lot of errands around caregiving, so things like grocery shopping, housework, preparing meals, managing finances, arranging outside services. And when we look at people who are caring for someone for more than 20 hours a week, that higher intensity caregiving column, you can see that 9 out of 10 caregivers are helping with transportation. So that can be anything from helping someone to get to a doctor's appointment to helping them get to other activities that they enjoy doing in their life. So, for example, if your father-in-law is a member of the Lions Club and he needs someone to drive him to the Lions Club, that would also be captured in this question. The other aspect of this is a lot of caregivers help with medical and nursing tasks. So more than 8 out of 10 in that 21 plus group are helping with medical nursing tasks, things like changing wounds, giving injections, using a catheter, and they're doing these type of tasks without any prior preparation, meaning no one has shown them how to conduct these medical nursing tasks. We also know that caregivers in more complex care situations are the ones who are most likely to be performing medical nursing tasks without preparation, and that 6 out of 10 high-burden caregivers are doing medical nursing tasks without prior preparation, which means that oftentimes caregivers need help learning how to do these things, and they haven't really been shown how to conduct these types of tasks. This is despite the fact that we know that caregivers are engaging in activities just like other members of the health and long-term care teams. So if you look at this slide, what you have on the left-hand side is caregiving activities such as communicating with professionals in healthcare, monitoring someone's condition, and advocating for them with healthcare providers, community services, and government agencies. And on the right-hand side, you can see this among all caregivers, cancer caregivers, so people who are the main reason they're caring for someone is cancer, and dementia caregivers, where the main reason you're caring for someone is Alzheimer's, dementia, or other types of mental confusion. I think this last one in particular is very important because when you look at advocating for someone, not just with healthcare providers, but community services and government agencies, this would mean in addition to the healthcare needs, that person is trying to get help with things like transportation. They're trying to help the community services and government agencies provide support to their loved one and allow the caregiver to continue to go on with their day-to-day life, in most cases with their career or with raising other family members such as children. And when you look at specific conditions, I think it's notable that among dementia caregivers, for example, even more people are doing that advocacy work. So thinking about in the context of transportation, if I have a family that's trying to get services and they want to know how to help get their elderly parent or relative to go to a particular location and to transport them there, when I'm thinking about someone who might have dementia or cancer, their needs might be slightly different than someone who is just older and maybe has some fragility that requires a different kind of transportation. And there's some wonderful resources that have already been shared with you. The Dementia Friendly America initiative, for example, is one that's tackling these issues of how do we make society more dementia friendly. And I would urge you to think about not just the person with dementia, but the person who's standing there next to them who's caring for someone with dementia. Other stats specific to transportation and caregiving, despite the need for support, we know that only 23% of America's caregivers have actually used transportation services. And we also know there's a little bit of difference here in the way that multicultural populations address that need. So nearly 9 out of 10 Asian American caregivers are helping with transportation, compared to 78% of white caregivers and 72% of African American caregivers. So one thing you should think about as you're developing these programs is how can you reach out and help these people. To me, this stat indicates that perhaps among the Asian American community, there may be an even greater need in reaching out to these types of families and thinking about not just expanding your services to make sure they include different types of communities, but that your marketing materials and other informational materials are culturally competent and they have the ability to put it in the same language as the people who are receiving the services is especially critically important. And this is just a breakdown again of that same question, use of services. Have you ever used transportation services? So you'll see it's about the same here actually for caregivers across the board, regardless of intensity, that it's only really 1 out of 4 that's using transportation services, despite the fact that many need it. On that same topic of diversity, people who are providing services and helping to reach out to families should be thinking about that caregiving is diverse. So we talk about caregiving in general, about being a middle-aged person who's raising children at home and caring for an older relative. And certainly when you look at the average of caregivers, that is the case. But when you dig in deep on the demographic data of who are America's caregivers, you can see there's a lot of diversity and that these groups are going to approach a problem like transportation in different ways because of those cohorts that they're in. So for example, we know that 24% of caregivers are 18 to 34 years old. And we also know that 7% are 75 or older. So while you might be able to get a 22-year-old to convince their grandparent to use Uber, you might have more challenge getting someone who's 76 to convince them to use Uber for their husband. So thinking about like what types of transportation might be available or good for these people, and how can I tailor information to them? So if my information is reaching older adults, is there a way I could also reach some of the millennials to let them know about public transport or other community services? I think the other aspect of this is thinking about household income. So about 50% of caregivers have less than $50,000 in income. And we know, too, from other research that's been done by AARP, that caregivers are spending as much as $9,000 out of pocket to cover the cost of care. So transportation is a piece of that. Thinking about what we can do to help alleviate or reduce the cost of transportation, particularly in rural areas or areas that don't have infrastructure. And I think also thinking about, from the caregiver's perspective, who else is going to need transportation. So you'll see, for example, about a third of folks have children or grandchildren in their same household, and they're also caregiving. So that means they may have people that they're taking to school, they're taking back and forth to activities, that they're taking to after-school care, and they're balancing that transportation with the needs of the person who requires care. We also have about, again, a third of people who are living in a rural situation, making it more difficult to access services and supports. And so the transportation needs in the rural community for those families are going to be slightly different than the urban and suburban community. I don't think it surprises anyone necessarily that there's actually, when you look at this data here, 28% of people are living in a rural area who are receiving care, but only 16% of caregivers are living in a rural area. And what that tells you is that you've got a lot of caregivers that are long distance. So they're actually going more than an hour to go care for people in a rural setting, And that added additional complexity to the transportation question. Finally, thinking about what types of services might also be available and what additional strain the caregiver might be facing. So 6 out of 10 people are employed while caregiving, and 10% of people have been in the armed forces. So are there ways, for example, that we can get employers or even services through the VA where we might be able to help somebody who needs assistance with transportation or even other activities around caregiving? And that's something that people maybe aren't always aware of, that many times employers offer flex time or telework, and they're able to accommodate someone who's a caregiver, and so that might alleviate some of the challenges with helping somebody get to and from their appointments and other needs. Likewise, the Department of Veterans Affairs has an extremely extensive program for family caregivers, and that program includes information, support, care coordination, and for people who are caring for a post-9/11 veteran, can also include education and financial support. And so that might be able to help reduce the impact of caregiving on a family and allow those people to fully engage or better engage in their communities. I would also say that in many cases, for many conditions, there are patient advocacy groups who are working on some of these topics. So in addition to the wonderful resources that are provided through the government and through groups like the National Association of Area Agency on Aging, there are patient advocacy groups that are sort of playing around with how to help with specific transportation needs. So for example, the American Cancer Society has a program called Ride Save Lives, and it helps you get a ride to go to medical appointments that are related to your cancer care. But what I love about this program is it not only helps you to get a ride, but it allows you to volunteer and to provide a ride to someone else. And so you can see that caregiving doesn't just have to be something that you do for someone you're related to or that you happen to know, but you can also as you want, give back to the community and give a couple hours a week and help somebody with that. So I think it's an interesting model, and it also illustrates how many patient advocacy groups are sort of thinking about these issues, whether it's cancer or dementia or mental health care. So thinking about those disease-specific nonprofits and how they might be able to partner in efforts to expand supports for caregivers and the people who need care. The other is thinking about disruptive innovation. So one of the great things about the National Center on Transportation is y'all have been talking about doing work and helping to facilitate partnerships with companies like Uber and Lyft to expand transportation. And so thinking about, are there ways we can integrate what people are currently doing into caregiving programs? Finally, I think when we look at the data, we could see that people need help with transportation. They are spending a lot of their time on transportation as well as other supports, caring for the older person or person with disability, but that they're not taking advantage of everything that's out there. So thinking about what can we do to share existing supports. And I think one here is just sharing the National Aging and Disability Transportation Center more broadly, reaching out to some of the communities that may not be aware of what it offers, and likewise the National Rural Transit Assistance Program. The second thing would be recognizing the diversity of caregivers and tailoring the approach to socioeconomic, cultural, situational backgrounds. So really thinking about, who is the population I'm trying to serve, and how do they approach this issue? And are there opportunities to approach it from an intergenerational way? If someone's uncomfortable or doesn't know how to navigate a certain system, is there a way that we can sort of find ambassadors that can help us communicate with this group? And finally, identifying transportation strategies that are appropriate to the community and the underlying condition, thinking about where there might be partnerships available with patient advocacy groups, as well as considering special populations, people who are living in rural settings, veterans, and people who may be low income and may have different resources or less resources available to them to be able to tackle this issue. So thank you so much. I appreciate the opportunity to talk with you today, and you're welcome to learn more about our work in caregiving across the lifespan at our website or by emailing us at info@caregiving.org.